There is a 15-minute task that most Medicare enrollees have never done, and it is costing them an average of $1,000 to $2,000 per year in unnecessary premiums and drug costs. The task is free, the tool is free, and Medicare gives you a window every single year to do it. Most people have no idea this window exists, let alone how to use it.
Let me introduce Frank. Frank is 72. He enrolled in a Medicare Advantage plan when he turned 65 and has been on the same plan ever since, 7 years. He assumed that once you pick a plan, it stays good. His annual drug costs under his current plan, $2,400. He has no idea that a different Medicare Advantage plan in his same zip code covers his exact same medications at $840 per year. Frank is overpaying by $1,560 every year, and he does not know it. Before I show you the comparison tool, here is why the stakes are so high. Frank is 72. If he lives to 87, that is 15 more years of this plan. At $1,560 per year in unnecessary overpayment, Frank will lose $23,400 over those 15 years, if his plan and his medications stay the same. But plans change every year. Formularies change every year. The overpayment can grow larger, or it can be eliminated in 15 minutes every October. Before the comparison tool, a quick foundation on Medicare structure that most people were never properly taught. Medicare has 4 main parts. Part A covers hospital care. Most people pay no premium for Part A if they worked and paid Medicare taxes for at least 10 years. Part B covers doctor visits, outpatient services, and preventive care. The standard premium in 2026 is approximately $185 per month. Part C is Medicare Advantage, private insurance that replaces Parts A and B. Part D covers prescription drugs. The 2 main paths for Medicare coverage. Path 1, Original Medicare, Parts A and B, plus a separate Part D drug plan, plus an optional Medigap supplement to fill the gaps. Path 2, Medicare Advantage, Part C, which bundles A, B, and usually D together in one private insurance plan. The fundamental trade-off: Original Medicare gives you freedom to see any doctor nationwide with no network restrictions. Medicare Advantage gives you cost predictability through an annual out-of-pocket maximum, but restricts you to a network. Why plans change every year, and why you must compare every year. Insurance companies renegotiate their Medicare contracts with CMS annually. Every October 1st, your plan releases its new annual notice of change, the letter most people throw away. This notice contains every change to your plan for the coming year: premium changes, drug formulary changes, network changes, and cost-sharing changes. Ignoring this letter is the single most expensive habit in Medicare. Now, the comparison tool that solves this problem: Medicare.gov Plan Finder. It is free, updated every October 1st with current plan data, and designed specifically to show you the lowest total cost plan for your exact medications at your exact pharmacy in your exact zip code. It takes 15 minutes. Most Medicare enrollees have never used it. Step 1 of the comparison. Go to medicare.gov and click Find Plans. You will need your Medicare ID number from your red, white, and blue Medicare card or your Medicare Advantage plan card. Have your card ready before you start. Enter your zip code when prompted. This takes 30 seconds. Step 2. Enter your medications. This is the most important step and the one where most people make mistakes. You need the exact drug name, the exact dosage in milligrams, and the day's supply per prescription. Do not estimate. Pull out your prescription bottles or call your pharmacy and ask for a printed medication list before you sit down to do this comparison. Accuracy here directly determines the accuracy of your cost estimate. Step 3. Enter your preferred pharmacy. Enter your local pharmacy first to see costs there. Then, critically, enter a mail-order pharmacy as a second option. Mail-order pharmacies often reduce drug costs by 20 to 40% for maintenance medications taken long-term. The Plan Finder will show you cost differences between pharmacy types. For Frank's medications, switching to mail-order alone saves $340 per year, regardless of which plan he is on. Step 4. Review the results sorted by estimated annual cost, premium plus drug costs combined. This single column, estimated annual drug plus premium cost, is the only number that matters for comparison. Not the monthly premium alone, not the star rating alone. The total annual cost for your specific medications at your specific pharmacy. Sort by this column and look at the top 3 to 5 plans.
Step 5. If a lower cost plan appears, verify before switching. For Medicare Advantage plans, call your 2 or 3 most important doctors and confirm they are in network with the new plan. Do not rely on the online directory alone. It can be outdated. 1 phone call per key doctor, 5 minutes per call. This step prevents the most painful Medicare switching mistake, losing your doctor on January 1st.
Let us watch Frank use the Plan Finder for the first time. Frank sits down on October 16th, one day after open enrollment begins. He pulls out his medication bottles: metformin 500 milligrams, atorvastatin 20 milligrams, lisinopril 10 milligrams. He enters his zip code, his Medicare number, his 3 medications, and his local CVS pharmacy. The Plan Finder loads his results in 45 seconds. Frank's current plan: annual cost $2,400 in drug costs plus $0 monthly premium equals $2,400 per year total. The Plan Finder shows Frank's results sorted by annual cost. The second plan on the list catches his eye. Same $0 premium, 4.2 star rating, covers all 3 of his medications. Estimated annual drug cost, $780. Frank stares at the screen. He reads it again. He leans closer. Frank calls his primary care doctor's office. In network with the new plan? Confirmed. He calls his cardiologist's office. In network? Confirmed. He switches online in 8 minutes. Total time from opening medicare.gov to completing the switch? 23 minutes. Starting January 1st, Frank's annual drug cost drops from $2,400 to $780. Annual savings? $1,620. Over the remaining 15 years of Frank's retirement plan, $24,300.
The 5 most expensive Medicare mistakes and how Frank made 4 of them for 7 years. Mistake 1. Never comparing plans after initial enrollment. This is Frank's primary mistake. 7 years on the same plan without a single comparison. Plans change annually. Your medications change. The lowest cost plan for you at 65 is rarely the lowest cost plan for you at 72. The one annual comparison is worth an average of $1,000 to $2,000 for people who do it versus those who do not.
Mistake 2. Choosing based on monthly premium alone. The most common mistake in plan selection. A plan with a $0 premium may cost $1,500 more per year in drug copays than a plan with a $35 monthly premium that covers your medications efficiently. The total annual cost, premium times 12 plus drug copays, is the only relevant comparison number. Frank's current plan has a $0 premium. His drug costs make it one of the most expensive options available. Mistake 3. Not checking the drug formulary before switching. Every Medicare plan has a formulary, the list of covered drugs organized into tiers. Tier 1 is lowest copay, Tier 4 or 5 is highest. The same drug can be Tier 1 on one plan and Tier 4 on another, a difference of $50 to $200 per prescription. Always check the specific tier of each of your medications in the new plan's formulary before switching.
Mistake 4. Missing the December 7th deadline.
Open enrollment for Medicare runs from October 15th to December 7th every year, without exception. If you miss December 7th, you are locked into your current plan for the entire following year. No hardship exceptions for forgetting, no grace period. Set a calendar reminder on October 15th to begin your comparison, and a second reminder on December 1st as a deadline warning. 2 reminders are worth thousands of dollars. Mistake 5. Not checking extra help eligibility. If your income and assets are modest, the Social Security Administration offers a program called Extra Help, also known as the Low Income Subsidy, that dramatically reduces Part D premiums, copays, and deductibles. In 2026, individuals with income below approximately $22,590 may qualify. Many people who qualify never apply because nobody told them it exists. The annual savings from extra help can exceed $5,000 per year.
The key decision between Plan G and Plan N. Plan G covers almost everything, predictable costs, no copays. Plan N, lower monthly premium, typically $30 to $60 less per month, but $20 copay per doctor visit and up to $50 for emergency room visits that do not result in admission. For someone who sees doctors frequently, Plan G may be cheaper overall. For someone in good health who rarely sees doctors, Plan N's lower premium often wins. Run your own numbers based on your typical annual doctor visits.
Step 2. Gather your complete medication list with exact dosages before October 15th. Call your pharmacy or log into your pharmacy app to get the exact drug name, milligram dosage, and days supply for every medication you take. Write this list on paper and keep it beside your computer when you do the Plan Finder comparison. This list is the foundation of an accurate comparison.
One more Medicare cost most retirees never plan for: IRMAA, the income-related monthly adjustment amount. If your income is above a certain threshold, Medicare charges you more for Part B and Part D premiums. In 2026, if your modified adjusted gross income 2 years prior exceeded approximately $106,000 for single filers or $212,000 for married couples, you pay an IRMAA surcharge on top of your standard Part B premium. IRMAA is based on your income from 2 years prior, called the look-back period. In 2026, Medicare looks at your 2024 tax return. This creates opportunities. If you had an unusually high income year in 2024 due to a large Roth conversion, a business sale, or other one-time income, you may be paying IRMAA in 2026, even though your current income is much lower. You can appeal this with SSA using Form SSA 44 to report a life-changing event that reduced your income. Your Medicare Action Plan. 5 steps to take this October. Step 1. Set 2 calendar reminders right now before this video ends. October 15th. Open enrollment begins. Start your comparison. December 1st. Deadline warning. Confirm your switch is complete or your decision is made. These 2 reminders protect thousands of dollars.
A critical note for people on Original Medicare, not Medicare Advantage. Original Medicare has no annual out-of-pocket maximum. One serious illness can expose you to tens of thousands of dollars in 20% coinsurance with no cap. A Medigap supplement plan, particularly Plan G or Plan N, fills this gap. Plan G covers nearly everything Original Medicare does not. Part A deductible, 20% coinsurance, excess charges. Plan N covers most of the same, but with small copays for doctor visits. Step 3. Go to medicare.gov between October 15th and December 7th. Use the Plan Finder. Enter your medications, your pharmacy, including a mail order option, and your zip code. Sort results by estimated annual drug plus premium cost. Review the top 3 plans by total cost and star rating of 4 stars or above. Step 4. If switching Medicare Advantage plans, call each of your key doctors to confirm they are in network with the new plan. Do not rely on the online directory. 1 call per doctor, 5 minutes per call. This prevents the most painful Medicare mistake: arriving at your doctor on January 2nd and learning you are no longer covered. Step 5. If your income is modest, under $22,590 for a single person or $30,660 for a married couple, spend 5 minutes at ssa.gov/extra help to check your extra help eligibility. If you qualify, the savings on Part D can exceed $5,000 per year. This is money sitting in a program that most eligible people never apply for. 5 minutes, potentially thousands per year. If this video helped you understand the Medicare comparison process, please share it with one person you know who has been on the same Medicare plan for more than 2 years without comparing. Frank's $24,300 overpayment is not unusual. It is the result of one habit that most retirees were never taught to break. 15 minutes every October
changes the number entirely.
Drop a comment. How many years have you been on your current Medicare plan without comparing? And after watching this video, will you do the Plan Finder comparison this October? Your answer helps me understand how common Frank's situation really is in this community. Disclaimer: this video is for educational purposes only and does not constitute personalized financial or insurance advice. Medicare plan options, premiums, drug formularies, and eligibility rules change annually. Always verify your plan options at medicare.gov or by calling 1-800-MEDICARE. For personalized guidance, consult a licensed Medicare insurance specialist or fee-only financial advisor. Call Money Retirement is not a registered investment advisor.